Hello, everyone. Welcome to another edition of CoverRight's Medicare Monday. I'm your host, Joseph Katz, here again with CoverRight's CEO, Richard Chan. How are you today, Richard?
I'm doing well, Joseph. How are you?
Excellent, excellent. So we're taking a slightly different approach today to our little chat. I got some slides up, but we're not going to go through every detail on these slides. I thought we talked today about out-of-pocket costs of Medicare. A few weeks back, we did a whole session on the cost of Medicare. We've had a lot of chat with folks about out-of-pocket costs. And so some terminology I'd love for you to cover are copays, deductibles, coinsurance, and those sorts of things. So maybe we could go through that by plan type and we could just see where this conversation goes.
Yeah, sounds good. Where should we start?
So let us start with Medicare Plan A. So talk to me about Plan A.
Yeah. So Part A is considered part of the default Medicare program, and it covers your hospital insurance. And so for most people, there is no premium to sign up to Part A when you turn 65. And the reason for that is if you've paid your Medicare taxes for at least 10 years while working, you basically paid into that premium. However, what a lot of people don't know is just because the premium is free doesn't mean when you go into the hospital that you don't have any out-of-pocket costs. And so there are a number of out-of-pocket costs, but the most important one is a $1,500 copay if you ever visit the hospital. That covers the first 60 days of your stay. And the important thing to note about that is for every benefit period, or in other words, every time you go to the hospital. So if you are in the hospital in January, it's $1,500, and you have an accident and you go back in September, it's also another $1,500.
So out-of-pocket Part A, $1,500 for each hospital visit. Let's jump into Part B, which is the medical insurance.
Yeah, so for Part B, this is, and a lot of people will probably see this come out of their Social Security check, is once you sign up for Part B, there is a premium that you have to pay for Part B. Part B is not free. What Part B covers is everything that's outpatient. So like it says here, doctor's visits, ambulance transport, medical equipment, outpatient surgery, x-rays, all of that is covered under Medicare Part B. The premium is $170, but it can be higher than that. So the thresholds in 2022, I think, are about $90,000 if you are an individual, or $180,000 if you file jointly with your spouse.
And correct me if I'm wrong, the premium changes every year?
The premium does change every year. So the premium can go up. So last year, the standard premium was actually $148.50. So there was quite a bit of a jump in 2022. It doesn't always jump that high, but it does get reassessed each year by the government.
Got it. And I see here there's an annual deductible for out-of-pocket expenses of $233. And that's for all those services that you referenced a second ago, correct?
Yeah, so you have to pay what a deductible is. It means that's the amount you have to pay first before the insurance kicks in. So every year, when you start using any outpatient Medicare covered services, you have to pay the first $230 before Medicare kicks in. And as it says on the page here, once it kicks in, Medicare will pay 80% of the costs, and you're responsible for 20% of the costs.
So for Part B, there's a couple of key things to keep in mind for out-of-pocket expenses. You have your monthly premium, which could be deducted by Social Security. You have an annual deductible, and then you have your co-insurance, correct?
That's right. Yep.
And that goes throughout the year, regardless. The 80-20, there's no maximum, correct?
Yeah, if you adjust on the default government program, that is uncapped. So yeah, it can continue throughout the year.
Got it. Let's talk about Part D, drugs.
Yes. So if you're in original Medicare, you do need to sign up for a Part D prescription drug plan. This covers everything for prescription drugs that you get from a pharmacy, basically. So it's not any prescription drugs that you're getting at the doctor's office or things like that that are administered by a doctor. It's anything you get at the pharmacy. Now, the premiums for those typically range from $7 to $99. And the average across the nation is about $42, based on some research from Kaiser. However, the more important part of prescription drug plans is the out-of-pocket costs. The way the drugs are covered for prescription drug plans is that they're tiered by the drug plans, and so the tiering can change from one drug plan to another. But the tierings basically determine how much of a copay or coinsurance you pay. And as you step up those tiers, tier like 1, 2, 3, 4, 5, tier 1 is typically your generic, tier 5 is specialty, your copays go up. And so it's really important to check your drug costs across the plan, because the premium is not the only consideration. Those copays probably in most cases will far outweigh which plan you select over the premium. And so that's how that works.
And is there a maximum for drug coverage that you'll have to pay out of pocket, or is it variable based on prescriptions?
So there is no maximum, but that is a good question. There are different phases of drug coverage, and this can be a completely separate session. But basically, there are different phases of the drug plan. There's the deductible phase where you pay before the insurance kicks in. Typically, that is split into different tiers. So generic drugs, you typically don't have deductible. Branded drugs, you might. And then once the plan kicks in, there is a limit. So around $4,430 in 2022. Once the total retail price of drugs that you're getting during a calendar year crosses that threshold, then you actually enter what's traditionally known as the donut hole or coverage gap. During that period, you pay 25% of the costs of the drugs. And then you pay that up until your total out-of-pocket costs to you, it reaches around $7,000 a year, after which you reach catastrophic coverage.
$7,000 in drug coverage is a lot of money.
Yeah, and so it's really important to check your drugs, because where you end up during the year, whether you cross those thresholds or not, really depends on your drug list and the carrier that you're going with.
So while we want to keep this somewhat short, I just have a quick question as it relates to Medicare Supplement, Medicare Advantage. When you have a drug plan with one of those programs, do they also have a donut hole and that 7,000 max?
And this is for the Medicare Advantage plans.
But I mean, are they different? Like once you're on a supplement?
Yeah. So a supplement only covers hospital medical, and so the Part D that you're buying here is a standalone drug plan.
Same Part D.
Same Part D, and that Part D is the same as the Part D that you find in a Medicare Advantage plan. And so those thresholds that I mentioned in terms of out-of-pocket costs, they're exactly the same.
Got it. All right. Well, so here a few things for people to keep in mind when they're evaluating the cost of Medicare: premiums by plan type, out-of-pocket expenses, deductibles, and coinsurance. Did I miss anything?
The only thing, but it wouldn't be related to original Medicare, is there's some plans that have maximum out-of-pockets, which do cap your maximum spend each year. But that's something we can talk about separately.
So that's when you get into a Medicare Advantage program where you have a different set of coverage.
Exactly.
So there is something else there, I guess people should keep in mind is there a maximum out-of-pocket dollar amount that they should be thinking about if they sign up for a particular program? And that's the max that they would pay out of their pocket. And then after that, the program would take care of everything else.
Exactly. That's right.
Well, Richard, a lot of information there. Obviously, people will have questions about coverage costs and types of plans, because I know we didn't get into the different types of plans, which obviously these things have some nuance around. If anyone has any questions, they can reach out to hello@coverright.com. You can go to our learning center, which is learning.coverright.com, and we'd be happy to answer questions and help you make a decision. So look forward to our next conversation, and thank you all for listening. Have a great day.
Joseph.